Hi, we're here today with Mary, our beautiful patient, and she's just looking for a little bit of a natural refresh. So we're going to utilize several tools today, one being hyperdilute Radiesse. And what I love about Radiesse is it's a biostimulator, meaning that it stimulates your own collagen, elastin, and as well there's a volume component. So it can replace some padding where you need it, as well as improves tissue quality. And for her, what stands out to me is a little bit of hollowing in the temples, in the preauricular area just below the cheekbone, some slight shadowing in the mental crease, in the nasolabial fold. Smile. She has really good cheek volume, so we're gonna leave those beautiful apples alone. I love her lips. She has a beautiful jawline. So it's just some little tweaks here and there to kind of soften the transition zones from the upper face to the mid face to provide a little bit of support back here. It kind of stabilizes the tissue and helps the fall forward that we get with age and gravity. And then we're gonna dust a few shadows in the chin and the nasolabial fold. I'm just gonna kind of mark out my treatment areas here. Okay, we can start on that side. So Mary just asked, how long does this last? And so that's a really good question that everybody wants to know. So what I've done is I've actually mixed the Radiesse with some Bellaro Balance, which is a softer HA gel. And so you're getting the collagen stimulation, the elastin stimulation of the Radiesse, plus you're getting the longevity of an HA gel. So we're firing on all cylinders here. But typically, I mean, you can get 2 years out of your own collagen and elastin, and typically HA gels will last about a year, depending on how much you work out, your metabolism. Everybody breaks it down a little bit differently, but for the most part, you could ballpark 2 years. What I love about Radiesse is that it's super versatile. So you can kind of determine how much volume you want. If you just wanted a skin quality improvement and no volume, we can sort of reconstitute the product so that we can achieve that aim. Some people just want super natural glowing skin, right? And the collagen kind of helps with the padding, and the elastin helps with kind of that skin quality when you turn to the side and you're laughing, and you just get a little more elasticity, bounce. So this is also another kind of controversial topic in injecting, and it's whether or not to inject the nasolabial fold. A lot of people say, no, absolutely not. You're gonna add weight to the mid-face or like this area around the mouth. I don't believe in hard and fast rules, and I like to focus on this little triangle right here. It's kind of a little sink, and with the sink you get trapped shadows, especially with overhead lighting, and it's an area that I find if you treat, you support deep on the bone there, it brings the tissue forward, and then the light doesn't get trapped, causing shadowing, which often will travel down the nasolabial fold. So you don't actually need to treat the whole line. You can just kind of treat inside this little corner beside the nostril. Mary, do you have any questions?
Well, is there any aftercare? Anything I need to be aware of?
So definitely be prepared for swelling, bruising. You can expect to have some puffiness. As you can see, especially in the temples, we're putting some product underneath vessels, and so those vessels can become a little bit more obvious. That's totally normal. It's going to settle down in the next couple days. Other than that, really, it's kind of just common sense. No gym for today. You can massage, you can use ice. So how did you find your treatment in terms of pain or discomfort?
I thought it was quite tolerable. The only discomfort is the initial poke. And then I assume that's the lidocaine kicking in, and I didn't even know if you were done or not. So as scary as it might look, it's virtually pain-free. I've had BOTOX that hurt more.
Wow, okay.
So that was great.
I'll take it.
That was great.
Amazing.
Thank you.
Such a good patient.